Good afternoon. I'm Alan Unell, and this is Healthcare Reform Advocacy, a series of videos that addresses problems in the healthcare system and has things that we can all do to take action to make it better for all of us. Today I want to talk about the looming government shutdown. This is mid-September 2023. I am always appalled that some politicians think that it's okay to close the government and stop funding major programs. This game of chicken with lives in the balance is beyond cruel and demonstrates no empathy or sense of responsibility to we the people. Axios recently reported on this shameful situation, and I want to share a portion of that with you. And then we'll have an action at the end to take. And it'll all be detailed in the description portion at the bottom of the YouTube video. So let's get started. Some of the programs that are being put at risk are WIC, Women, Infants, and Children. It's a nutrition program for low-income families. SNAP, which is food stamps. Head Start, to make sure that children start learning early. Public education, and food safety. So those are at risk. There are also healthcare programs that are at risk, and some of them are going to sunset at the end of September. Some of those are community health centers. The community health center funding provides about 70% of the federal funding for health centers, and it's due to expire September 30th. Now, that may not sound like much, but these are 1,400 separate organizations in the United States that provide health care to 30 million of us, most of them uninsured. Now, let's be clear, if we had universal health care, all of this would be taken care of. Here's another one. I got to tell you, I learned this one today. I had no idea it existed. It's called DSH. It's the Medicaid Disproportionate Share Hospital Payment. And these are hospital payments. They're payments to hospitals that the government makes up to hospitals that are overly burdened with uninsured people and Medicaid patients instead of regular insurance patients. Now, let's be clear. This would all go away if everyone had health insurance like universal health care, but we don't yet, and so the government has to help give extra money to cover people who have no insurance to keep these hospitals open. America's Essential Hospitals is an organization. They warned in a letter to Congress just last week that there's a looming $8 billion cut to hospitals coming October 1st. Okay. Pandemic preparedness. Wow, you think that matters? Reauthorization of the Pandemic and All Hazards Preparedness Act has been held up by partisan disagreements in the House. Big surprise. Here's one, PEPFAR. Have you thought about that one? PEPFAR is the President's Emergency Plan for AIDS Relief. It invests in the global HIV/AIDS response, and it is now embroiled in battles around the abortion that are playing out in the House of Representatives. This one makes my blood boil. Somehow, Republicans have gotten the idea into their head that PEPFAR pays for abortion somewhere in the world. It does not. I will include a link in my newsletter, which will be in the bottom, to a Washington Post article that proves that it doesn't. But you know what? Anything to stand in the way, I suppose, is okay with them. Okay, P.S. This program, PEPFAR, was started by a Republican president whose name rhymes with Bush. Okay, opioid funding. There are a range of programs that are aimed at fighting the opioid epidemic that Congress has passed in 2018, and they're up for reauthorization. If the budget doesn't get approved, the money isn't there and the programs go away. All right, this is not acceptable. We sent these people to Washington to govern, not to withhold food or medicine or health care from people that need it most. This is just a level of cruelty I find hard to imagine. I don't know how these people can live with themselves. Okay, there is an action. I'm going to put it into the area below. And what we should do is let our congressional representatives and senators know We need them to be courageous and to stand up for us. There is a resist bot letter that you can send to your representatives. All you have to do is on your cell phone, text to 50409, text the letters SIGN, S-I-G-N, space PFCSSJ, and you'll send a letter to your representatives telling them to get on the ball and pass a budget and keep these programs intact. That's it. Like it, share it, read what's below, and you can sign up for Healthcare Advocacy as well, which is our daily newsletter, and get it in your inbox. Have a great day.